All right, we'll move on to our next session, and we'll have it on stage, on screen, soon. Ladies and gentlemen, our next speaker coming up on stage is Dr. Khairul Faizi, Managing Director of Remedi, and he'll be speaking on focus on your medicine practice and leave the rest, including e-invoicing, to Remedi. Now, ladies and gentlemen, please put your hands together and welcome on stage. Dr. Ali, yeah, come on. Big round of applause, ladies and gentlemen. Thank you.
Assalamualaikum, very good morning. Thank you to Disruptive Doctors for inviting me for today's talk. I think I am following through from Dr. Junaidi directly from his talk just now. How do you make your clinics more efficient, more sustainable, as well as how can you focus on building an honest as well as sustainable business? So I think where we come in from Remedi is that we will make sure that your clinic operations run smoothly by giving you the best in terms of clinic operating systems, I would say, and so that you can focus on really delivering your care to your patients and leaving the rest to the system to manage your day-to-day activities in the clinics. So I will start, although I think the emphasis that was given to me was about e-invoicing, but I think the more important call for here is how do you make sure that your clinic operations runs optimally? This is my list of contents in terms of introduction and the rest. I will start off with the company itself. So Remedi has been around since 2012. I used to own a clinic at one point in time, and I was so frustrated with the system that I think decided to speak to a few friends, and the combination of the system that you see today is actually a combination of feedbacks, also knowledge from running a clinic as well as a small medical center to a system which is functional and is still giving up feedbacks from fellow doctors as well. So from 2012 to 2017, we have been putting in a lot of R&D to the system, and from 2017 till now, we have close to about 600 clinics nationwide, still strongly providing support to the clinics. I think this is really quite a universal problem we have. We've got different disconnected systems. If you own one clinic chain, one clinic is okay. It's only one clinic you manage to. But if you have multiple clinics and you've got some clinic patients that goes around to your clinics, how do we make sure that the data from these patients move around? Secondly, of course, because we've got fragmented ecosystems of different healthcare systems. For example, clinic uses one system, TPA uses another, KKM for reporting uses another system. So there's a lot of duplication of data sets. And of course, in terms of when you want to make some decision making, for example, what Dr. Junaidi was mentioning just now, what kind of niche services that you want to go for, you don't have enough data to tell you which way to go to. A quick update about the system. Our team, we are about 25 people nationwide, fully homegrown, Malaysian-based, and we have fully Malaysian talents running the company, providing systems for the whole country. Just echoing what Dr. Junaidi was mentioning to you just now, of course, there's a lot of struggles in GP as well as clinic owners, stagnant fees for the past long years. Rising costs is another thing that has been making your operations difficult. There's also TPA pressures, as what Dr. Jenny mentioned just now, 90 days for you to get paid. And last but not least is, of course, chain competition across the clinics. So what we're trying to do here is, realizing all these struggles that the GP have, we want to make sure that what's the next remedy to your struggles, right? So I think in white paper, the healthcare white paper, one mentioning of how do you make sure that you're sustainable, as well as how do you make sure that your operations as well as your clinic run smoothly, is to embrace the digital portion. So we have been in the business for the past 15 years, making sure that the digital part of your clinic operations run smoothly. And let me just tell you a bit about the system so that you know what we mean by you can mostly take care of your headache through Remedi, and you can focus on really delivering your care to your patients. Number one, whether you own one clinic or you own multiple clinics, the system grows with you. So we have a few actually in our clinic have been using our system. We've seen them grow from 1 clinic to 10. We've also seen from 1 clinic to 26 as well using our system, because you just need to add on more clinics as you go, and and it's really modular for you to expand your business. That's number one. Number two, we really take care of your feedback, and the support system to you as a clinic owner, it's directly through the WhatsApp support group. If you need any help directly, you can ask us directly to the group, and we will take care of your concerns. I'm not too sure whether in the room you have dental team as well. If we have somebody from the dental team, we also have dental charting as well in our system. And last but not least, we really take care of the patient's data and safeguard, making sure that we were one of the first few back in 2017 to have using system in the cloud. So we have very quite expensive knowledge in terms of how do you run a system from the cloud perspective, including the data safeguards as well as data protection. The first one I would like to highlight is we redesigned the whole system from ground up. And this is based on our knowledge on operating clinics. So what happens is, I had frustration last time, and a few of our team as well, that you will have to understand the system workflow for you to complete your work, your clinical workflow. Instead, it should be the other way around, right? The system should be guiding you to complete your clinical workflow rather than you figuring out how to complete the system. So that's what we did. So this is what we call as flow-based design. So staff, doctors or administrator, you just need to follow the boxes on the top, from registration to reception to doctors, under treatment, pharmacy, payment, as well as completion. So the system will guide you through. And our training is very brief. We have one full day of full training, and after that, our staff, your staff will be able to do it on your own, and it's very easy, user friendly. Secondly, we have designed in such a way that the patient summary is such a way that it's easy for you to look at, right? So there's a summary in terms of EMR, or electronic medical record summary. There's a summary of the visits, and there's also graphical representation of their vital signs. So that and also if you look at the left, you can see that there's also clinic name also on the left side, which clinic that the patient visited. So this is very important. If you run a clinic chain, you will be able to see within the same chain of clinic that you own, where does the patient been to. So some of the clinic owners have told me that this has been able to allow them to know if patient were to hop around for MC or for medication purposes, because your other clinic's data will be also visible to you. As well as we also have visibility of other medications as well from other doctors in your clinics, so you know what's going on with this patient in one glance. Similarly, during the COVID time, we were the first company to also offer virtual consultation in the same platform. So you don't need to move out from your clinic system to another non-approved platform, whether it's Google Chat or WhatsApp. That's not something you would like to be on. So we have to make sure that it's built in, your virtual consultation as well as the physical consultation in one platform. You can see the animation is if your clinic or yourself as a doctor is ready for you to start booking patients online, virtual, you just put that online so the patients will know that there's a doctor waiting at the clinic. So how do we achieve this? So our clinic solution is built in together with the patient's portal. So you don't have to invest more for you to create a patient's app. We have a patient's app already built in attached to your clinic. So patients can just look at the map. You can see there's a screenshot of the map. If they're nearby your clinic, you should be able to either set an appointment, set a virtual session, and you can set the virtual session for them to pay ahead of time before they get into the queue. Or they can just go set a physical session where they go straight away to appointment in your clinic. So this is already built in. Again, we built the system in mind so that you can focus on your day-to-day delivering care to your patients. So this is another screenshot of virtual consultation between a doctor and a patient directly from our platform. And you can straight away on your right side, you can see that you can already straight away put in the symptoms, everything else. And you can also, if the patient has been to your clinic, you'll be able to see their medical data before on the previous visits as well. This is very important. I think Dr. Janelli made a very good point. For you to run a business, you need a sustainable data sets, as well as you need to know what's going on with your clinics. So this, again, I borrow some of the clinic owners thanking us with them having these data sets at your fingertips. You don't need to call the staff. Can you give me what's the sales like today? What's the current patient number? Some of them, while the doctors are overseas attending conferences or on holiday, they can just open up their account and see what's going on at their clinics directly. So we are very big in data dashboarding. So you don't need to ask for your staff for them to tell you, okay, I need a pie chart of what's going on. We also have a time of the day when your doctors are working, which highest number of the time of the day that patients are, whether it's 12 o'clock in the noon, 3 o'clock, so you can start making your plans for your clinics better. We have also introduced smart inventory system. So I think this is a very, very important part, or they call it back office. So you know which medication is low in terms of its stock. You will also be prompted which medication is expiring in how many days. You can also set multiple pricing for you for different use cases, whether it's for TPA, for self-patient. We have also built in a smart reporting and audit trail in the system. So over the past course of 8 years in the system, in the market, we have gathered quite a number of clinics feedback, what kind of reporting that they would like to. And you can see we have quite extensive reporting module, whether from TPA panel report, sales report, incomplete sales report, inventory report, patient report, doctor insights report. So all these reports, I think, is a combination of all the GP's feedback. So pretty much it's quite extensive, and a lot of clinic uses our standard reporting for them to even send the invoices directly to the TPA and sponsors. Not just that, this audit trail has saved so many clinic owners from unfortunately, and this I've got to also share with you, some clinic owners have difficulty in managing staff. So we have to also accept the fact that not all staffs are trustworthy. So the audit trail allows them to look back which staff did what kind of edit to a particular time, whether it's an administrator, whether it's a staff, whether it's a doctor. So we can trace back what happened to any particular time in the system. So again, multiple times that our audit trail have helped doctors manage medical legal cases even. So I think this is something that I think a lot of people do not, take into account, but this is a very powerful one. This is why I have highlighted here. Again, just giving you a peace of mind while you see patients, let the system does the rest of the things to you. We have also included SST expansion recently, so you don't have to worry about SST. So we have also included whether you want to put forth all your items during invoicing or during receipt generation, whether you put all tax exempted, whether items are 6%, whether it's 8%. We have updated the system time to time to make sure that you don't have to think twice about complying to the government's perspective. So this is already built in now. And the thing about Remedi is you pay us subscription on a monthly basis. The updating of the system is free of charge. So if the system needs to be upgraded, it's updated by us. It needs to be maintained, it's maintained by us. You don't have to worry, you don't even to have a physical server on your clinics anymore. About medicine display catalog, this is another thing that we have also updated the system. So you don't need to print it out. You just need to set in the system, in the medicine catalog, you just set it up. The system will generate a QR code. If a patient needs to go and search for any medication pricing, they can just scan the QR code and they will be able to see on their phones. And you can even set up to show all the medications, whether it's the highest number or highest sales, highest selling price or the standard selling price. You can set it up yourself. So don't take our word for it. I think I've been very honest with our clinic owners to say whether or not we have our system is robust. It is robust, but whether or not it has, we do have sometimes that we do have lagging in the system in terms of when the users are high, but we're constantly monitoring the system. But most importantly is that when you need us to respond to you in the support group of the clinics, our team is round the clock. So we do have 2 shifts of staff manning the whole country from 7 a.m. to 4 p.m. in the afternoon, and from 4 p.m. to 1 a.m. at night. So some clinics operate 24/7. So again, I think this is differentiating us from the rest of other clinic management systems provided. I will have to dedicate one portion of about e-invoice integration. So some of this e-invoice already has been completed by some of the GPs, which have more than 5 million ringgit worth of transaction. But those bulk of the GPs will be in effect in January 2026. So if you have your system needs to comply to e-invoice, now is the good time for you to start moving to us. We do have some migration engine from different systems back to Remedi. So the first thing that you need to do is to employ Remedi as an intermediary in the LHDN system. So we are already a approved intermediary in LHDN. So basically you need to, using your own e-invoice MyTax system, you need to appoint Remedi as an intermediary to send you on your behalf. Once you've done that, our team will also teach you how to activate the e-invoice integration in the system. And with that, you will be in each of the patient's receipt, you can see there's a QR code. Patient can request their own e-invoice if they are paying on their own. Or if they are part of the TPA, we will also have a QR code for them to fill it up, for them to request. And at the end of the month, during consolidation time, you can see which invoices have already been submitted to LHDN. It will tell you in the system whether, if it's an individual e-invoice for the patient, it will tell you patient has requested on the right side yellow. If the submission has already been done by the LHDN and is consolidated, is completed, you can no longer change this. But if you need to void, you need to void it at the LHDN. I think that's how the system is being done by LHDN side. And last but not least, you can see also whether or not it's completed but not yet consolidated. So again, having a peace of mind for you not to worry about LHDN e-invoicing, we have already upgraded this for free. So we do know some of our competitors charge premium money for the system to be included with e-invoicing. We've done it completely for free because I think from a GP perspective, this is something that you need to comply. So again, a peace of mind you don't need to worry about, which we have taken into account. Now, I would like to take last 2 minutes of my talk to tell you the exciting thing about, I think the primary care is an untapped business, and I think this is where I think while we are trying to chart things to move forward. Number one, we have introduced CX market. CX market is a B2B market, maksudnya clinics, you can browse directly in our market to buy your medicine. Right? So we have quite a number of big vendors that we have put forth, and soon you will be able to. We have one partner and a bank trying to also make sure that this is an easier process for you. It's like buy now, pay later concept, right? So secondly, we are integrating with a few labs for us to for you to order the lab test for patient, and also receive back the results directly from our system as well. So this will be coming, inshallah, in 2026 soon. Number three, I think echoing what Dr. Junaidi was mentioning, right? So sales is good, but no money in the bank. And sometimes you just need this like 10 or 20,000 for you to really pay certain things in your business. So we have built in CX finance into clinic system as well. So believe it or not, you can use our sales data from the system, submit this to a third party, and then they will analyze your sales data and tell you, you can actually draw down up to 200,000 ringgit worth of loans, short-term loans, and they will tell you if you take, for example, you submit and then your limit is given 50,000. You can draw down 50,000 in one shot, or you can draw down like 10,000, and it will tell you how much money you have to pay back. Sharia compliant, and it's a fixed fee. Sounds too good to be true, but this is exactly what we built with another very interesting. The last portion, of course, with the wealth data that you have in your clinic, what we're trying to make sure is the clinical decision making will be a smarter choice with Remedi AI. So this is what we're trying to do now, is that we've got a grant for us to run this AI because we have already quite a wealth of data. It will help you to make sure that your diagnosis is much smarter. Your symptoms will be guided to a certain diagnosis as well. So a few screenshots, we do have Go Pharma in one of our vendors. A few more big ones coming in soon. So you'll be able to browse this medication. We have about 3,000 now. Some of it is also not just generics, also branded. We have also a few more coming up soon. This is what I'm telling you about the diagnostics. You can print out the order, the barcode for you to put in the lab, the urine or the blood, and you can get the results directly from our clinic system. Last but not least, the finance is where you can really tap whether you want to use the money for you to pay a quick one at the end of the month, or you need the money to expand. We have more financing partners coming into the platform. If you use our clinic management system, the data that you have in the system can be used for these finance purposes. So proudly to tell you, we have served 600 clinics. Thank you. We have about almost 7,400 doctors on using our system, because most of the doctors per clinic, you've got locums working on. And we have been serving about 12 million patients visits to our clinics, thanks to all of some of you already in the room. Thank you, and that's pretty much looking forward for us to move further.
Thank you so much. Ladies and gentlemen, please give a big round of applause to Dr. Khairul. We have our Slido session here. If you have any questions for Dr. Khairul, you can scan the QR code. But if you do have any live questions from the audience, please don't be shy. Any questions from the audience, sir? No? Anything from Slido so far? Nothing yet? Don't worry, it's anonymous. We'll send it up. And if you've not had a chance to put up your questions here, not to worry. Yeah, we have one here from the floor. Let's get that.
Sorry, I think you have mentioned it just now, Dr. Azam. How do you do the transition between the current clinic systems to your system? Is it going to be a hassle or not?
Okay, depending on which system you are on, so usually what we do is, if you are already on certain systems that we have migrated before, we've got an engine, we just need you to get the data to us and we'll migrate for you. If you take our yearly subscription, we will do it for you for free. So if you just, so for us, we also know clinics, sometimes you like to pay us whether it's monthly or yearly. So if you pay us monthly for your system, we just have a small fee for you to do this migration. But if you pay us the 1 year subscription, we just do it for free. If the system is not yet, we have no engine for us to migrate the data, we will ask you to get a SQL format from your previous system, pass to us, we will do the analysis and we'll move the migration. So far, our migration time is about 3 to 4 months, I'll be very frank. But most of clinics do not have any problem because they can use directly the system and they can refer back to the old system for any references. So by the time that we did some studies, about 10% of the patient is recurring, so you can just copy from the old system to our system is quite seamless.
So we will not lose any of our data from the
No, if we have your data from your previous system, then you will just get the data directly from our own system.
So we have to boost outside, right?
Correct.
I see just data.
Yes, so you don't have to, yeah, thank you.
Great, I think you've got one sign up already, you know? All right, we have a question from the floor. What's the price per month or per year like for a subscription?
If you are a single clinic owner, so we have, your cost for you is 125 plus per month. because we have to pay SST. But if you are part of a chain clinic, more than one, so we got it's a bit slightly pricier, 150 ringgit per clinic per month. So per year just times by 12. But if you pay by a year, basically you got a promotion running, so you got 1 month free. So technically it's you just pay 11 months of a subscription, you got 12 months use. We have also other add-ons if you want to use WhatsApp integration, meaning patient get an updated appointment, birthday reminder, as well as WhatsApp blast campaign. That's another additional on that. So that's pretty much quite reasonable. So I think that's the current. You can pay us weekly, monthly, or yearly. I think again goes back to whether or not you have the capacity to pay. So it's very quite friendly to your pocket, I would say.
All right. Do you have any other questions from the floor? Not to worry. Dr. Khairul will be at his booth. Remedi is right outside his door also. Thank you so much once again for Dr. Khairul. Please give him a big round of applause. Thank you. Thank you, sir. We're going to move on to our next session, which is quite interesting. It's going to be a forum. But before we move on to the forum,